how to develop language in nonverbal autism, moving from a state of non-vocality, where even voluntary sounds are difficult, to first words and phrases, or from few, often unclear words to more advanced language skills. The aim of this video is to give you a perspective on my therapeutic approach and what I professionally consider to be most effective for this issue, and debunk the myth that for non-verbal kids, there's nothing to do but set up visual aids and hope for the best. If a child stays non-verbal past a certain age, it indicates specific issues we must address to help language emerge. Traditional speech therapy won't yield results. Excellent speech therapy, but it's not effective here as it doesn't address the root of the problem. So what's the real issue with non-verbal autism in my experience? In 95% of cases, it's not a lack of communicative initiative, no. It's not a problem of verbal comprehension. I'll expand on this later. I've discussed it in many videos, but no, it's a non-linguistic issue, as the child knows what they want when pulling you towards something. It's not comprehension, as they know what water means when pointing to it. It's a motor issue, a motor programming problem. I think the word, that's where language ends and motor programming begins. Speech, not language. My brain must activate and program an articulatory movement, okay? I thought water, but then I have to do water. And that's where we have the problem. We have kids who open their mouths and stay silent, kids who try to speak but can't continue, they're stuck, okay? So verbal apraxia is an issue called verbal apraxia, affecting over 63% of people diagnosed with autism. For level 3 autism, this percentage rises dramatically. Treating verbal apraxia requires a specific therapeutic approach. Traditional speech therapy based on model and repeat isn't effective. My brain watches and copies the movement, but with verbal apraxia this isn't possible. So we need a specific approach, okay? What approach do I think is most effective? It's integrating tactile inputs. So using touch to move the mouth, jaw, face, and so on to reproduce on the child's face the movements the brain needs to make. This way, the brain records these passive movements as the movement patterns it needs to produce a specific sound. Over time, it gradually becomes able to do it. One of the most effective methods, not the only one, is the prompt method. So let me introduce Puffy, my childhood sleep buddy. Let's pretend he's a child, a boy, and so on. Mom, give me water. I want this. Okay, so we're mapping it out. Dad, here. On the child's or patient's face, these movements. We're working on the motor programming of speech. Motor programming of speech alone isn't enough in most cases. Many families tell me they've had no results after 1 or 2 years of prompting. Why? Because there are other crucial aspects to address. Without a holistic approach, we can't achieve concrete, satisfying results. Because in most cases, when there's verbal apraxia, not only with an autism diagnosis, but also various syndromes, Down syndrome, prematurity, and many other conditions, we face issues at other levels that must be addressed to enable the child or youth to produce speech and to control their facial movements, essentially to command their mouth and tongue. We need to focus on sensory perceptions, how my brain processes external inputs like noises, visual stimuli, smell, taste, and touch. When I feel something, my hands and body sense it. Proprioception, my body awareness. Vestibular inputs, sense of balance and body position in space. In autism, there's an alteration in how this information is processed. A common example, a child covering ears due to noise sensitivity. This affects all senses, not just hearing. For verbal expression, we focus on vestibular, tactile, and proprioceptive input. Ever had dental anesthesia? The anesthesia affects. It doesn't act on your muscles, animation, or neurological aspects, but on the sensory part to numb pain. How badly do you speak after anesthesia? So consider how crucial sensory perception is for controlling your oral facial area. I work on this with oral motor therapy and Novaphone, among other methods. Okay, so the Novaphone, for example, is this vibratory tool that provides deep vibration. It's used for many things, but I'll just show you how it gradually works over time on the sensory perception inside and outside the mouth. Fundamental component number 2, muscle strength and endurance. It's a kind of vicious cycle. When using lips, mouth, tongue, and cheeks to speak, you lose muscle strength and endurance because The muscles aren't strong enough to handle the effort we need to make to pull the tongue back and round the lips. Imagine how much movement our facial muscles support just to speak. It's crucial to do exercises that strengthen all the muscles in the oral facial area. I use one effective method. Again, I'm talking about oral motor therapy. Let's explore it. These are just a few examples of muscle work. In months, you'll see faces change, profiles emerge. These beautiful kids arrive, but they look babyish because their cheeks have that baby fat, like a baby who hasn't developed strong facial muscles yet, with heart-shaped cheeks that lack strength. I'm being quite brief in explaining this, but I'm trying to fit everything into a reasonably short video. Okay, another key aspect is archaic reflexes that haven't disappeared. These primitive reflexes are reflexes we're born with because our nervous system isn't developed enough for voluntary movements. However, these reflexes should gradually fade away over time. They should be replaced by voluntary movement. But this isn't always the case when there's neurodevelopmental delay. Lingering primitive reflexes affect control of voluntary movements. Key reflexes include rooting, sucking, and tongue extrusion and protrusion. These are truly fundamental. I see huge differences when I identify and address these reflexes. Another key point, work within real communicative experiences. We can't just sit and name cards or images. Why? We must communicate and convey the beauty and utility of verbal language. We speak to connect, express needs, comment, share emotions, and work within structured language, not just mechanical repetition. A child who's never spoken needs to get used to it. I see kids who name cards well but stay silent at home and school. It's crucial to work on real communication experiences. Practice while playing, ask for water when thirsty, and focus on verbal articulation. Use actions, throw a ball, give things, stack cubes, all while speaking. Lastly, we work on training parents and, if possible, teachers too. It's pointless to work behind closed doors for 45 minutes, then meet again next week. Lastly, with apraxiaofspeech, it's crucial to practice. Studies show that the ideal is 20 minutes twice daily. It's not feasible, and parents shouldn't become therapists, but they should know the goals. We must give them tools to practice the child's speech skills naturally at home through play or daily routines. This way, the child can exercise and adapt to this motor programming, gaining real communication experiences not in therapy but at home or school, as we discussed. So we move from learning to speak to actually using verbal language, which is crucial. We teach skills, train, and create home treatment plans. I hope this video was helpful and you enjoyed it. Let me know if you want to explore any topics further or have questions. If you enjoyed it, and I'll see you in the next one. Bye.